With the Hickman central catheter line that was implanted in late December of 2012, this was something where, the doctor had said there were patients that have this for up to 2 years. I was somebody that did not want to have the Hickman central line for 2 years and wanted to get rid of cancer as quickly as I could. But I want to give some of the advantages, some of the disadvantages of the Hickman central line. And for some people, it would work really well. For other people, I don't think it would. And before I get too detailed, one of the questions I remember being asked, waiting to go into the surgery was, you had mentioned you have a son, and how old is he? And I said, well, he's 8, but he'll turn 9 in February in about 2 months. And they said, well, he'd be okay. We don't want you to have maybe like a 3-year-old or younger that could possibly jump up and tug on one of those and actually hurt you really bad, not even realizing what they're doing. And they said, so we always try to check with people, beforehand if they have any children or anything like that. Not that anybody wouldn't have to be careful, but you have to watch that. Okay, first, some of the advantages of the Hickman, central line. First of all, I was a person that was not necessarily afraid of needles, and I was able to take shots or, get blood tested all the time, but not nearly the number of times that I realized what it was going to involve. So this was easy access for actually drawing blood without a needle stick needed each time that the blood was going to be drawn. This was something I think that the nurses, and I had dealt with nurses at, not just a visiting nurse at home, different nurses and techs at UPMC Shadyside Hospital, in the adjoining Hillman Cancer Center, and also the Arnold Palmer Cancer Center in the Greensburg Lake Trobe area were really, really helpful with this also. One of the other things, too, that the Hickman, I think, helped was the ability to deliver, as I had mentioned, different chemotherapy medicines, different solutions, all simultaneously running through different channels, in the IV pump. And this was something where, your veins in your arms, or even the strong vein in the side of your wrist that you might feel kind of by near where they feel for your pulse, these veins could not handle or tolerate the amount of fluids that would be coming through. Family members said to me one time when I was visited in the hospital, and I would usually be admitted on a Friday, stay till a Monday, for 4 days, that I had been hooked up to some type of fluids for over 90 hours straight. Part of those would be the chemotherapy time, part of it just regular fluid, but they want to keep that coming through, that fluid's coming through, so your body, processes it. Now, some of the disadvantages, though, of the Hickman central line, is something where, it was implanted surgically into the chest, that tube, and then sutured in so it would not move, but the 3 lumens were hanging out, dangling from your chest at all times. Now, every week, the dressing that you see around the actual sutured in part entering my chest, that dressing had to be changed every single week. And I was never allowed to change it. It had to be changed by the visiting nurse. Every time you take a shower, the hospital would give me something called an AquaGuard, which is kind of like press and seal, that you might cover leftovers from dinner or something, or just cover a pot with. And that would be put over top of the area with the lumens taped up under there to try to keep everything as dry as you can. Bacteria or infections, due to this being external, was something that really was something you had to watch for, or common. Every single day, just like taking a shower, you would think, oh, I have to cover that every day. You also had to worry about flushing and something called heparin locking each of those 3, lumens coming out. So I would be supplied by a company called Chartwell that was associated with UPMC, and they would send to me boxes of 10 milliliter saline flushes and about 2 to 3 milliliter heparin syringes that would be used that every day you would have to flush each one of the 3 lumens to prevent a clot. If you don't do that, then you could possibly have a clot. So that was something every single day that had to be done. The visiting nurse actually taught me how to do it and taught my family how to do it, so I was able to, make sure I didn't have that problem. Some of the more, practical or basic things to look at are just what clothes you're going to wear. And much of my time with the Hickman was in winter, so I had, bigger clothes on, jacket, sweatshirt, hoodie, whatever, and it would hide that really well. Short sleeve shirts, would be something where, you could see that. Oftentimes when you sit down, you had to watch and make sure that the lumens weren't hanging out from below your shirt. Something where, people are going to be staring at you and they had no idea that was there and then realized that it is there. It limited the amount of motion or movement you could do. I don't think I was permitted to lift anything over 25 pounds, particularly on that right side, while you had the Hickman in fear that it could possibly, get misplaced, turn a little bit, and cause a problem inside there. I had mentioned earlier that, whenever you get a CT scan, sometimes the doctors might order, a dye contrast or iodine to be put into you prior to that. A Hickman line is not able to actually take in, that type of injection. So it's not an injectable port, kind of like the one I'll talk about in a minute, but it wasn't able to do that. So you still are going to have to get a regular IV set up in your arm or in your wrist. The two most serious problems that you could come up with probably from a Hickman would be an infection from bacteria, which, if you're not cleaning it every day, if you're not, actually saline, flushing it or using heparin, that's going to be a huge problem. Or actually I had mentioned thrombosis, where you would get a blood clot somewhere due to that line. You have a foreign substance going into your vein. That was a problem. The last story I want to share with you on the Hickman line, though, is one time during one of the routine flushings by the visiting nurse. This was around April of 2012. I had already had the Hickman in for about 4 months. In the process of her just saline flushing it seemed to be as slow as she normally did. One of those lines actually split. It broke. And when it broke, luckily it wasn't the main channel that was coming out of the main tube coming out of my chest, but it was one of those, the blue or the white one on the side that ripped. Now they were able to stop it from bleeding or anything from the fluid coming out of it once it broke, but I did have to go back to Shadyside Hospital that day, and the IV team was able to repair it. They had told me, the only other alternatives would be to remove the whole thing and put a new one in, or to remove it and actually place a port, which I at that point had known that after my radiation therapy, I was going to have to do that anyway. So